Dr. McDaniel, how can I get the same luscious, full-bodied, silky smooth hair? Is a question that I literally never get. But a question that I frequently get is about the recovery time after a certain surgery. While of course this will depend to some degree on the type of surgery that's performed, there's some commonalities that are involved there. For example, after facial operations, there is about a 2-week social recovery that I inform patients about during their consultation. This 2-week social recovery allows the swelling and very rarely bruising to usually resolve to the point that someone couldn't casually tell that you had an operation done. For more important events, of course, like a wedding or some other important social engagement, I recommend that patients give a longer duration of recovery, usually a minimum of 8 weeks. This allows the scars to be at such a point that you should be able to apply makeup and have those be barely visible, and that there's no lasting effects of any swelling that might be visible, that might be noticeable from your close family members or friends. While there are some commonalities between different operations, the specific activity restrictions will vary based upon the type of surgery that's performed. For example, breast augmentation surgery or any use of breast implants in reconstruction or a mastopexy augmentation will require a 6-week upper body activity restriction. The reason for this is that most implants are placed underneath the pectoralis major muscle. When that muscle activates, it will squeeze the implants and want to widen the space that those implants are sitting in. Keeping upper body activity down for 6 weeks allows the scar tissue around the implant to grow nice and strong, to resist that motion, and try to prevent the implants from falling out, for example, towards the armpits when one lays down. With regards to operations like abdominoplasty or tummy tuck, the 6-week activity restriction has to do with hyperextending or straightening up too much for the first 6 weeks. Reaching up to the top shelf, doing yoga or Pilates are also good examples of the restricted activities. In this case, I am not concerned about the scar or the incision coming apart, but rather I don't want that scar to widen at all. The goal is a nice fine line scar, for which we work very hard in the operating room to achieve that. With regards to most operations that I perform, there's a 3-week activity restriction with regards to getting heart rate and blood pressure up. In this case, what we are trying to avoid is elevated blood pressure causing a rupture of healing blood vessels that are still fragile for about 3 weeks after surgery. Getting the heart rate up is a proxy for the blood pressure. If you can tell that your heart rate is going up, it's likely that your blood pressure is elevating and putting you at risk for increased bleeding, swelling, bruising, even a hematoma or a blood collection. Although we can't feel our blood pressure, our heart rate is a fairly good surrogate for that evaluation. Patients may generally return to work between about 5 to 10 days after surgery, depending on the type of operation that's performed. This also may have to do with the patient's pain tolerance and the activities that they're required to perform as part of their job. If the patient's job interferes with the activity restrictions, then the patient needs to avoid that specific type of work until the activity restrictions are over. The amount of pain that patients experience after surgery varies greatly depending on the patient themselves as well as the type of operation that the patient is having. Although patients will frequently describe sensations of tenderness, soreness, and tightness, severe or excruciating discomfort is very rare. In my practice, I use multiple tools to decrease the amount of discomfort that the patient experiences. These tools include a precise surgical dissection, injection in most operations of a long-lasting numbing medication that's called Exparel, which lasts about 3 days, use of Tylenol and ibuprofen, initially around the clock and after that on an as-needed basis. In addition, some operations, patients receive a muscle relaxant, which helps to decrease discomfort from muscle spasm. Most patients also receive a prescription for a narcotic medication. Most patients need the narcotic medication for a short amount of time at a low dosage. Typically speaking, post-surgical garments, such as a post-operative bra or an abdominal binder are easily concealed under clothing. Similarly, operations that require a drain, such as a facelift or an abdominoplasty or a lower body lift, these drains are able to be easily concealed under clothing. These soft silicone tubes with a reservoir attached are kept in place for a week in the face and in the rest of the body until they are putting out a certain minimal amount of output. And this process usually takes between 1.5 and 2 weeks. In patients who have drains placed, such as facelift or abdominoplasty operations, patients will need to empty and record the drain outputs until those drains are removed. Another question that I frequently get is whether or not there's anything that a patient can do to speed up their recovery process. It's important to understand that patients can get discouraged if their mind expects their body to be done with the recovery process before the body can actually catch up and finish the process by itself. Our bodies can only repair wounds, get rid of swelling and inflammation at a certain rate. If we expect that we're going to be done but our body hasn't achieved that, we set ourselves up for disappointment with the process. To answer the question though, there are a few things that patients can do. The first thing is to obey the activity restrictions. The activity restrictions are in place for a specific reason, to allow the body to catch up with the healing process as fast as possible. The second thing that patients can do is to increase the amount of protein that they're taking, both before surgery as well as after surgery. I recommend a protein intake of at least 80 grams of protein per day, which is quite a bit, for 6 weeks before and 6 weeks after surgery to aid in wound healing. Thank you for taking the time to watch this video. Hopefully this has been an educational and insightful look into the post-surgical recovery process. At Gallatin Plastic Surgery, we are committed to trying to achieve the safest and most effective surgery for patients, as well as the most comfortable one. Please don't hesitate to give us a call at 406-577-2346. Send us an email at info@gallatinplasticsurgery.com or visit us on the website at www.gallatinplasticsurgery.com and hit the Contact Us link. Hope you have a great day and thanks again for watching.